Patient identification.
Patient identification is of paramount importance. The first thing that we need to do at the positioning is to identify the patient, to make sure that the patient coming in is the correct patient. Usually in the hospital, there will be a microphone announcing a patient, asking the patient to go in a certain room. Now, I'll use this example. The patient's name is called Lau Lai Man, right? But it so happened that there might be another patient called Lau Lai Man, right? Sounds very similar, and in a very noisy environment, when the announcement was made, Lau Lai Man 小姐請進入2號房. Could be that another patient, Lau Lai Man, may be coming in, and that Lau Lai Man is reading the mobile and you hear that. So it's really important that we have to confirm that the patient is the correct patient. Now let's start. Now when we ask the patient, stand up. When the patients come in, the doors close, then we start to ask the patient's name. Never do this. 小姐你係咪劉麗文啊?
Oh no.
Now, in many cases, the patient will just answer yes, but this patient might be 劉麗文 instead of 劉麗文, right? And then if I ask, 你係咪劉麗文? The patient might say yes, just easily say yes, right? So what we'll do is, 小姐你叫咩名啊?
我叫羅麗文。
Good. Okay, something like this, right? Now the other thing is there are a list of patient identifiers, including name, telephone number, ID, etc. And in the hospital, usually we use two identifiers to confirm the patient identity. One is the name, the other one will be the ID number. So instead of besides asking the patient's name, we'll also ask the patients, 你嘅身份證係幾多號啊? Okay, now we assume the patient read out the number and then you check with the request form and make sure that this is the correct patient.
Patient preparation.
Patients are required to change for certain examinations. The basic principle is to remove all the clothing and artifacts or accessories that will cause artifact on your image. Basically, it depends on what region that you're going to take. Things like necklace, bracelet, and then ring or transdermal patch has to be removed if it is in your region of interest. Moreover, when you ask the patient to change, please give clear and easy instructions. And when you call them in the examination rooms, please check whether your instructions has been followed. We will go into details on how are you going to ask your patient to change in individual examinations.
Patient safety.
So to ensure patient safety, it's very important that when we ask the patient to lie down, we need to raise up our X-ray tube and then lower the couch for him. So can you please take off your shoes? So whenever you try to move the couch, make sure that his hand is not on the edge of the couch, because there is an incident that the radiographer have makes the patient's hand fracture without paying attention when he moves the couch. So you can try to move the couch with his hand on the couch. Okay, like that, without grabbing. Okay, it's very dangerous if you move the couch while your patient's hand is holding at the edge. Okay, just always make sure that this is on the couch. So after you finish the examination, again, you need to raise your tube and ask your patient to sit up. If not, you will bump his head. Okay, when getting down. So it's finished. Thank you.
Patient privacy and LMP.
To protect patient privacy, we do not ask patient private or personal information in the public area. We cannot ask her the LMP and then the ID in the public area. 小姐，你身份證幾多號啊？我嘅身份證係
What? No.
你對上一次經期幾時嚟啊？
What? No.
So it is very inappropriate to do like this. So what should we need to do is actually invite her to get in the examination room, right? While with the door closed, okay, so we can ask right now. Okay, this is what we need to do actually.
มาครับ
So let's take chest as an example. And if we are doing a PA chest for him, so what we need to do is use a PA marker, just like that. Okay, and of course we put it into the corresponding side, which is a left marker. So I'm going to put it on his left side. Okay, this is called a pong marker. Okay, so please raise your chin. Okay, so please hold the body like that. Internally rotate your hand. Both of your hands. Stay very close. Okay. So this is what we do for PA chest. We put a PA marker on the patient's left side. We usually use a supine marker, okay, which is like that. So let's take chest as an example again. So please face to use hold your hand like this. So let's move a little bit. Yeah. So this time we're going to put a supine marker for this patient. And again, of course, we're going to indicate the side for this patient. So if it is a left lateral chest, we're going to put a left marker, but in a supine position for this wheel, okay, like that. To take an AP projections for him, we are again going to use a supine marker. So this time maybe we are going to demonstrate an AP shoulder for him. Okay, yes. Again, if we are going to take the left shoulder for him, we need to use a left marker with an supine orientation.
So please be aware of the difference between AP supine and PA, and to use these markers in an appropriate orientation.
detectors and cassettes
There are two types of image receptors in the examination room. One is the detector, and then the other is the CR cassette. We will use the CR cassettes for demonstrations. You need to be aware of the cassette size for individual examinations. Correct cassette size is required for the radiographic skill evaluation. So let me introduce the cassette size for you. This one is the 18 times 24 cm cassette, which is the smallest one in the lab. And this one is a little bit bigger. It is 24 times 30 cm. Sometimes we call it taopin. And then this one is the largest. We usually use it for chest and abdomen examinations. And the size is 35.4 times 43 cm. We call it diapin. Okay, so this is basically how we call a film. But this one is just for introductions. We do not use it for the demonstrations in the labs.
variation among radiographers
The first block of the summer placement, when you're in certain center, be sensitive and try to see what's the acceptance of palpation of that center. It really varies among different centers and between different radiographers. So you have to be sensitive to see whether they are adopting non-touch technique or they are more liberal and allow the radiographers and students to feel for certain surface landmark.
systemic approach
Lastly, I'm going to share with you a principle which is very important in radiographic positioning. This is what I call a systematic approach. In simple words, it means that a radiographer should conduct the positioning in a systematic manner, doing things step by steps. A common pitfall for a radiographer is to go straight to centering, but in fact, there are 3 steps before centering. Please note that we have excluded request form reading, patient identification, and patient preparation in this systematic approach. The 8 steps of the approach are equipment readiness, briefing to the patient, that means a short introduction to the patient, alignment of the patient, centering, collimation, briefing practice or reminder of breath holding, exposure making, and lastly, aftercare.